Hi everybody, welcome to Healthline. I am Gregory Zarian. Okay, summer is here. How excited are you? You're in shorts, you're in t-shirts, you're at the beach, you're at the park. Just because summer's here doesn't mean you have to get lazy. We at Healthline always invite you to get in your minimum of 150 minutes a week to do your exercise. Go to the gym, swim in the pool, get active. Parents, go outside and play with your kids. That also means being healthy and being prepared. Wearing your sunscreen, drinking water. Just because you swim doesn't mean you're being hydrated. It just means paying attention, having a first aid kit. Paying attention, poison oak, snake bites, all of it. Summer's here, it just means being more aware. Now with summer being here, it means you're more active. So there's more wear and tear on the body, more wear and tear on the knees, more wear and tear, period. The entire conversation today is about your knees. Now let me start off with this. According to the American Academy of Orthopedic Surgeons, more than 15 million people in the United States suffer from osteoarthritis of the knee. Of these 15 million people, there's a large portion of the population diagnosed with early to mid-stage osteoarthritis. I can't even tell you what that is, so I thought I'd bring in my friend, Dr. Michael Abdulian from Glendale Adventist Medical Center. He is a sports medicine orthopedic surgeon. How are you?
I'm doing well, Gregory. Thank you.
Good to see you. It's been quite a while since we've been together.
It has. I'm glad to be here.
Doctor, out of the gate, I want to address what osteoarthritis is.
Sure.
What is it?
So osteoarthritis is basically the wearing down or deterioration of a joint.
So it doesn't mean it is arthritis in fact?
It is. It is a type of, it's basically what we consider as degenerative arthritis.
Okay.
There are different types of arthritis, this being the most common one, degenerative arthritis, which comes from wear and tear of our joints.
I want to spend a little more time on that in a moment, but as I was saying in the intro, summer's here.
Summer's here.
We are beating ourselves up playing at the beach, swimming, more active. How much of a pounding do our knees get every day?
So think about this. Every time you take a step, your knee is feeling the force of your body weight. And the reason why is because we live on Earth, which has gravity. So every step you take, your knee sees that physiologic load. And you have to remember that the heavier you are, the greater the stress and force that those knees see. And so over time, they will deteriorate faster. So being active is very, very important because activity is good for your overall health, which will keep you slim and keep your knees preserved for quite a long time.
And here's the truth. Let's all just dive to the vanity part of it. A lot of people need to be slim. A lot of people want to be slim.
Absolutely.
A lot of people that are overweight have excuses, which leads to an unhealthy sedentary lifestyle.
We all make excuses. We can all make 15 to 20 minutes.
I love that you're smiling.
We can all do 20 minutes of some sort of aerobic exercise every day. Think of the 20 minutes you waste on the computer. Instead of wasting it on a computer or surfing the net, do something active. Take a walk, take a swim, buy some weights and do something to burn those calories. It doesn't mean that you have to eat grass for the rest of your life. You can eat the things you like. You can eat the unhealthy things in moderation, but it's very important to incorporate some kind of physical activity, not only for the health of your knees and your joints, but for your overall body health and your heart.
We're going to talk a lot more about that. Okay, so we're going to go to our first break. This is what I want you to do. I want you to stand up, have a glass of water. I want you to maybe do, you know what? This is what I want you to do. Do jumping jacks. It's simple. It gets your heart rate going. More with Dr. Abdulian when we come back, and we're going to share with you what you need to know about keeping your knees healthy. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Did you do your jumping jacks, and did you have a few glasses of water before we dive back into the topic of knees? I just want to invite you to join us on social media. Please follow Glendale Adventist Medical Center on social media at Facebook, Twitter, YouTube, and LinkedIn to learn about services, awards, new physicians, and as I love to give them, health tips. Please call the physician referral line at 818-409-8100 to get as much help as you need. And I also want to share with you one great tip that I learned right before we started. Glendale Adventist Medical Center is certified by the Joint Commission as a hip and knee replacement center of excellence and recently received the Women's Choice Award for Orthopedics. Circling back, the entire conversation is all about our knees today. Joining us is orthopedic surgeon from Glendale Adventist Medical Center, Dr. Michael Abdulian. And you're an award winner. Congratulations.
Thank you.
You work with an amazing team. Dr. Phil Mara is my surgeon.
Yes. So we have a wonderful clinic. It's the Spine and Orthopedic Institute at Glendale Adventist. And we have 11 physicians there. We have 4 full-time orthopedic surgeons. We have
you, Dr. Merritt, Dr. Orlando.
Dr. Carlo Orlando, Dr. Leah Siren, and myself.
And you've all been your Healthline alumni.
Yes.
And then we just did a great show with Mort Rizvi.
Dr. Rizvi, who is our hand and microvascular surgeon who also does plastic surgery. We have our whole spine team. We have Dr. Matthew Chong, who's spine surgeon. We have Dr. Yasser Bader, neurosurgeon. We have Eileen Wong, physical medicine and rehab, and Dr. Chris Charbonnet, who's our pain management specialist. We have 2 podiatrists, Dr. Hermos Ivazia and Dr. Phil Shoup. So we can literally cover you head to toe.
It's kind of like a spa day.
It is.
So I kind of want to make an appointment, come in from head to toe, know everything that's happening with my back, my spine, and end up with my feet.
We're ready for you.
Fantastic. So if you have any questions about anything from head to toe, please call 818-409-8100, and you have this list of doctors. Okay, so I want to back up a little bit.
Sure.
We were just talking about how much weight, in fact, impacts your knees. Mm-hmm. And before the show, you and I were talking about, I believe obesity in this country is a pandemic.
Absolutely.
Over 75% of this country, parents, kids, is obese.
Absolutely.
And then we talk about how my knees hurt, my feet hurt, and I don't think many people really understand that being that overweight really complicates your physicality.
It does, absolutely. So besides the wear and tear that it puts on the joints of your lower extremities, you have to think about the damage it does to your heart, all the other problems you can get from it, diabetes, high cholesterol.
Heart disease.
And these are things that you have to start taking medications for, having interventions for, and slowly you deteriorate. I think that it's probably the single most important modifiable risk factor, because obesity can be modifiable. If we live a healthy lifestyle, if we eat right, we keep active, you can shed the pounds, you can bring it down. The important thing to remember, though, is it doesn't happen overnight. Remember that, guys, doesn't happen overnight. It's something that you have to commit yourself to. In America, we like the quick fix. Unfortunately, there's no quick fix. You have to incorporate this into your life and give it time and patience, and you will see results.
Well, it's a lifestyle choice. There's a young lady that we've had on Healthline quite a few times. Her name's Melissa Lands, and she does the Fresh 20. She says it takes just as long to sit through that drive-through line as it does to be at home with your family, to cut up carrots, to cut up celery, to cut up a healthy meal for your family that you do together instead of spending so much time apart from one another.
That's true.
Okay, so get your health on, people. Get family time back. Close the computer, put down your gaming, because even gaming in this country is a pandemic, and get family time back. You go to dinner and you see family members sitting there on the phone. Put your phone down. Ask your kids what they did during the day. Get to know each other more and lose weight and be healthy. Okay, I am off my soapbox. Okay, doctor, you brought a couple examples of knees.
Sure.
We're going to talk about partial knee replacement.
Sure.
This one right here.
Yeah.
It's the full example of a knee. Share with us.
Yeah.
Share with us exactly what goes into our knees. What these are made
your
out
knee,
of.
your knee is basically, your femur bone, your tibia bone.
Well, the femur bone, just so people know.
Femur bone is your thigh bone.
So from your hip down.
Hip down
Okay.
to your knee, and then from your knee down to your ankle is your tibia bone.
Okay.
And the edges of the bone are lined with cartilage. And the joint itself has a little bit of fluid in it, and that is what provides that nice fluid motion when you walk. There's a lot of other important structures in there, like the meniscus and the anterior cruciate ligament, other ligaments that provide knee stability, provide cushioning for the knee, which all play a role in the normal mechanics of your knee, which are all structures that also can wear down over time, contributing to your arthritis.
Is there any way to just keep your knees healthy?
Absolutely.
So, so you don't have to wear and tear. What's a preventative way to not get so much wear and tear on your knees? I know that, we take steps, we run, we jog, I work out 1,000 times a week. So I know that I have to do some knee health and prevention. What are some of those?
So the most important thing is, like we said, it comes back to it, obesity. Keeping the overall weight down so that your knee sees less stress on a day-to-day basis. Besides that, you want to exercise regularly, and if you can try to do a physical exercise that does not allow or does not cause for too much pounding. So if you can...
So much impact.
Exactly. So if you could do an elliptical versus running on a concrete surface, that would be better for your knees. Swimming is also very good because there's no force on your knees or your legs. So things like that. Running is very good, especially running on terrain that's very rugged. You use more muscles and you can engage other parts of your body and your core, but you can put a little bit more stress on your knees.
Okay, so just be more active. More with Dr. Abdulian when we come back, and we're also going to share with you what makoplasty means. Don't go away. Welcome back to Healthline. The entire conversation today is all about our knees. Joining us is orthopedic surgeon from Glendale Adventist Medical Center, Dr. Michael Abdulian. Doctor, and I'm going to probably address it at the very end again about, so bottom line is you just don't wake up obese.
No.
You, other than having hereditary ailments and family disorders and maladies or whatever, people sit on the couch, they watch TV, they don't get active. One day turns into weeks and months, you become obese. You then are in trouble. We can reverse that and get our health back.
We can.
So much wear and tear ends up on our knees. Let me bring back our good
knee
friend. I'm going to call
yeah.
Sam.
Okay.
So just say, even with an athlete, you were talking about running. You know, I'm a runner, so instead of running on concrete, run on sand. Instead of running on cement, run up and down dirt. I mean, there's things we can do that are preventative from so much impact.
Yes.
You wake up one day and your knee is shot.
Yes.
I've had a double meniscal surgery and a single meniscal surgery. What is that before we dive into the knee replacement?
So the meniscus is a C-shaped structure in the knee which basically serves as a shock absorber.
Can you use that real quick and just show us where
Yeah.
our kneecap is right in front?
So the kneecap would be in front. We'll move Frank's kneecap out of the meniscus is usually between the femur bone and the tibia bone on both sides. Don't look at this metal here, we'll talk about that, but right here. And it's a C-shaped structure.
Okay.
And it basically cushions the knee. So with every step, it absorbs some of the stress that your knee sees. Over time, it can wear down, but younger people can usually tear it from some sort of athletic injury of some kind. And what we do is, having meniscal surgery, sometimes the meniscus is removed or partial, part of it's torn. We just take out the torn part. The more meniscus that's taken out, the less shock absorbing ability your knee has. So your knee sees more force. It can wear down further. Another very key important structure is the ACL, the anterior cruciate ligament. Prevents your tibia from going too far forward on the femur bone. And if your knee has too much mobility like that, then other parts of your knee can get damaged, which can also lead to accelerated arthritis.
So then if you're feeling any pain, any joint muscle, anything, go see your orthopedic surgeon and always stretch, always take care of it. And if you feel a tear or something, call your doctor.
Call your doctor.
Your knee is shot. You need partial knee replacement. Please share with us then what happens.
Okay, well let me tell you a little bit about the total knee replacement first, and then I'll tell you about the partial. So the total knee replacement is the traditional knee replacement that we have where the end of the femur bone and the end of the tibia bone are cut off with a saw because they're rough, painful edges.
I just felt that. Okay.
You won't feel anything during the surgery.
Great.
And these metal caps are put on and they're cemented in place, and a plastic insert is put between them. So now you have the normal motion of your knee without the rubbing of those rough and damaged arthritic surfaces.
Which is the popping and the scraping.
Yes.
And you get the constant pain of this. Okay.
Yes. This is a very good option for someone whose entire knee is damaged and completely gone. These are great for eliminating a lot of the pain you feel, but because of what you have to do and certain ligamentous structures that have to be removed, people sometimes will complain that they feel, it feels kind of mechanical. It doesn't feel like a normal knee or a natural knee. And so the ACL is one of those important structures that gives us that information that tells us where our knee is in space, makes it feel like a normal knee.
Great.
Now, assume that the entire knee is not shot.
Okay.
A lot of times the inner part of the knee will wear down faster than the outer part of the knee because of the anatomy.
Got it.
And so...
Same with men and women?
Exactly.
It just happens?
Exactly.
Okay.
And differences in alignment of the leg can play a part, but generally speaking, the inside wears down quicker. Now, if just the inside's worn down and a patient complains of pain just in that right spot, why cut the entire knee up and put a total knee replacement in when you can just resurface or replace that damaged part?
Which then means partial knee
Partial knee replacement. So that's something that's really gaining momentum. It's been around for quite a while, but it's really gaining speed in terms of popularity. So we would basically just resurface one portion of the
part that's damaged.
The part that's damaged.
Or
Absolutely.
not even so much damage, that's just kind of eroded through time
Yeah.
and exercise.
And by doing this, you maintain this band here called the anterior cruciate ligament, the ACL.
Okay.
And by doing that, the knee feels more normal, it feels more natural, and people are very happy with the overall result.
And this is then called Makoplasty.
Well, Makoplasty is a type of system to
It's a
do
type
it.
of system. Got it.
Yeah.
Okay.
And it's actually a phenomenal system, and we're very fortunate at Glendale Adventist to have it because it's a computer navigation system. And the way it works is you have a CAT scan of someone's leg, and it maps the knee and the part that you want to replace. And there's a robot that is guided by a computer, which has a little tip on it, a rotary burr tip, and it cuts only the bone or only the part that's going to be resurfaced. And the beauty of it is it prevents you from drawing outside the lines, as we say. So it prevents you from...
Well, it keeps it then very, very specific as to what
specific and precise. So it increases our precision of putting in these components.
Okay, so someone comes in, has, as we were just saying, Makoplasty.
Yes.
And the company is by Shark.
It's actually Mako Surgical, which is now owned by Stryker. But
Stryker.
Yes.
Was I correct, though, with Stark at some point?
It does have a fin on it.
That's it. Okay.
Yeah, that's why
See?
you're thinking Shark.
Okay,
But yes.
I'm good at this thing. Okay, we're going to hang on to that. We're going to hang on to the fin and the shark. And it being in summer and people go to the beach, we're going to share with you what the recovery time is after partial knee replacement. And we're going to also end more with how to keep these puppies, your knees, healthy. Don't go away. Welcome back to Healthline, and again, please visit us at our website at adventisthealth.org/Glendale. Before we wrapped out, I was sharing with you about the fin and Makoplasty. The Makoplasty procedure is an FDA-cleared treatment option for patients who suffer from osteoarthritis damage in the medial inner portion of the knee. Joining us is Dr. Michael Abdulian, orthopedic surgeon from Glendale Adventist Medical Center. Doctor, you shared with us that most of the partial replacement is on the inside.
Yes.
Are there other surgical options?
Well, of course, there's, if the outer part of the knee is damaged, and that's the side that's damaged, we can replace just that one. Sometimes...
Same way?
Same way. Same way with the robot.
So inner and outer.
Inner and outer, and then the kneecap, or the surface of the kneecap where it rubs on the femur, what we call the patellofemoral joint. If that's the site of damage and the site of pain, we can also use the Makoplasty system to just replace that one portion of the knee.
So someone comes in, they have a Makoplasty procedure. What is the recovery time?
So the recovery time is, of course, different for every person, but these surgeries are done usually on an outpatient basis. So you actually come to the hospital, get your surgery done, or go home. Sometimes they'll stay one day, or one night, we should say. But usually we get them up and walking same day. They'll need a little bit of help with like a walker, but we get them walking pretty quickly. And we encourage them to continue walking. And pain is really basically the only limiting factor that they have. And when you do a partial knee versus a total knee, the amount of surgery that's performed is less, so their amount of pain usually will be less. They recover faster than a total knee replacement.
What is the recovery time?
2 to 4 weeks of, right after surgery where they're walking well, they feel comfortable.
And you want patients to walk.
Absolutely.
You want them to, because a lot of people think, oh, I'm going to have my legs up in ice. You want movement to happen.
Absolutely. You don't want the joint to get stiff. You want them to walk. You want them to move. You don't want them to lay in bed all day long. They're not going to damage the repair.
Do you find people do that? Like, oh my gosh, I've had surgery, so I'm not going to move.
Well, there are some who are worried about the pain, some who are worried about damaging things they think they should, which is normal. But we encourage them to walk.
Then if you did the surgery on somebody that plays tennis per se, when do you let them go back on the court? Is it, once again, contingent on what the pain is?
Exactly. I wait for their incision to heal, which would be a couple weeks.
Okay.
And if they're walking fine, usually they'll have to do a little bit of therapy to strengthen their leg afterwards. and they can get right back into the sport that they enjoy.
What was interesting is after I had my my meniscal surgery with Dr. Merritt, I said, what about me and physical therapy? He said, do what you do. He said, because I'm a run, I'm an avid spinner. He said, just take care, do stretches. If there's anything that is abnormal in regards to pain, come back and see him. But my physical therapy was me being active.
Absolutely.
Do you recommend any holistic herbs and supplements, like, turmeric with pepper is supposed to be really good. There's collagen tablets out there. Do you go hand in hand with that?
I am a firm believer in whatever works for an individual, as long as it's safe. And a lot of these herbal supplements are safe.
Okay.
There are some people who take them and they do gain relief.
Okay.
And they think that it helps them. Then use it. Why not? And there are some who don't. I haven't seen too much evidence in the orthopedic literature that shows that these herbal supplements have a significant impact to the point where we've incorporated them as a treatment option. But there's a lot of people out there who use it and they swear by it. So there's something behind it.
Do you love my hand going up? Thoughts on the knee, Doc? What do you want us to take away specifically in regards to our knee and our knee health?
The most important thing is keep yourself healthy. Exercise regularly. We can all make time and make healthy choices. Just like you said, it's all a choice. But be physically active. You don't need to, run marathons every day. You don't need to scale Kilimanjaro, okay? But do something and keep yourself healthy. If you are having knee pain, get it checked out.
No, pain, when you say pain, are you talking about excruciating pain or tightness?
I'm talking about pain that's a little bit more than the normal, I worked out pretty hard and I'm sore and it's not getting better.
You mean the pain when you're sitting in the corner crying, going, why isn't this going away?
Exactly. Or the pain that you're feeling saying, man, I'm not 25-year-old anymore. So
age is just a number.
It is just a number. It is. Absolutely.
So final thoughts, last question. To the family that work full-time and their comment is, oh, I don't have enough time. What is your thought to them?
Wake up a half hour earlier.
Thank you. Okay, so you heard it from Dr. Abdulian. Wake up half an hour early. You are the captain of your ship, and you can take control of your body any second, any moment that you want. You just don't wake up and become obese. You have that one ding-dong, that one cookie, that one piece of pizza that turns into a day, turns into a week, and then you end up 30, 40, 50, 60 pounds heavier. This is a car, and the better we treat our car, the better off it runs. With every excuse, there's an absolute healthy solution. At Glendale Adventist Medical Center, our mission here is whole person care and God's love. And personally, it's important for me to pass on to you all you need to know about being healthy. We just don't wake up sick, we become sick. Please visit Glendale Adventist Medical Center on their website, adventisthealth.org/Glendale. And we are all over social media, Facebook, YouTube, LinkedIn, and of course, Twitter. And you can always find me at Gregory Zarian. Take care of your knees. You control how fast they go, how slow they go, and whether or not they do go. Remember, the most important conversation you are going to have is about you and your health. So why don't you have a healthy one right now? We will see you next time. Have a great summer, Healthline fans.